discussing the particular anxiety disorder, I'd like to discuss one incident with all of you. Because I came across this incident, and uske baad, when I was reading about this particular anxiety, I could correlate this anxiety and that incident. So I'll just share that with you, and then we'll move ahead. And if in case you also think it's related, please do let me know. So what happened once, एक inspection के दौरान I went to a school. वहाँ पर I was interacting with very young kids of third and fourth class. So in one of the class I found there was a child. तो बहुत शांति से एक कोने में बैठा हुआ था. He was just listening very carefully, but वो बोल नहीं रहा था. The way बाकी बच्चे उछल कूद रहे थे, वो शैतानियाँ कर रहे थे, बात कर रहे थे. He was not doing that. So that grabbed my attention, and I went to him and I wanted to talk to him. He talked to me. बहुत अच्छे से प्यार से उसने बात की, and बहुत तरीके से he replied to all my questions. But still I felt कि there is something wrong, because there was something which I thought was not normal, which was very different. I'll not say it was abnormal, but yes, it was different from the other, kids playing around him. So I asked, the class teacher, ki, I hope everything is normal. This, child is all okay and everything. Then she shared with me that the child, doesn't have his mother, or during giving birth to him, the mother expired, and now he is taken care only by father, and father is really very good. He didn't get married again, and father gives him 200% attention. Whatever he needs, all the expensive gifts and everything he gets. But still, the teacher told me that इस बच्चे को जब बहुत तेज़ हवा चलती है तो he just cannot bear the touch of the wind. मतलब वो इतना डर जाता है उस तेज़ हवा से कि जो भी उसके पास होता है, टीचर हो, पेरेंट हो, उससे जाके ना चिपक जाता है. So later on, this incident was there in my head, right? And this takes me back to the day when I gave birth to my baby, and the doctor said कि आप अपने बच्चे को उठा के अपने सीने से लगा के रखिए. So then I inquired कि क्या फ़र्क पड़ता है कि अगर बच्चा बेड पे हो या या मैं उसको गोद में लेके बैठी हूँ. डॉक्टर ने बोला बहुत फ़र्क पड़ता है अगर आप अपने बच्चे को अपने सीने के पास लगा के रखते हो. The child gets a warmth. There is a feeling of safety and warmth when you hold the child close to your chest, and this is something which literally passes on to the child, and even if he is not conscious and aware, but the subconscious mind records this, and he is getting that warmth, which is literally very important for the neurological and the normal upbringing of the child. So मुझे ये दोनों incident बहुत ही related लगे, because if the child has not got that warmth, during his early years, the development is not so normal, और वो दिखता है, unless and until आप बहुत ज़्यादा केयर करो या बहुत ज़्यादा इस चीज़ को रिकग्नाइज करके करेक्टिव एक्शंस लो, अगर आप नहीं ले पाते हो तो वो दिखता है. So what I was wanted to talk today is related to separation anxiety disorder. So when I say separation anxiety disorder, as the word itself says, कि separation means the fear of getting parted with your loved ones, and this separation anxiety disorder is common among adults as well as children. So separation anxiety is something which is not uncommon. It is common, and it is very common among children. If it is not taken care of, it can happen and go up till adulthood. So when I say that separation anxiety is common in a child, researchers say that a child can have separation anxiety from the 8th and 9th month, and it can carry on till 2 years of age, right? And even beyond, if proper training or proper methodology is not taken care of in handling the child. So when I say separation anxiety is common, but what is not common is separation anxiety disorder. एज आई सेड कि एज 9 मंथ से लेके 12 मंथ तक, नॉट 12, इनफैक्ट 2 years तक सेपरेशन एंजाइटी हैपन्स इन अ चाइल्ड, बिकॉज एक चाइल्ड को लगता है कि अगर उसका लव्ड वन और मदर इज गोइंग अवे, ही फील्स दैट एंजाइटी, ही विल क्राई, he will make all the tantrums. But after 2 years of age, the child starts understanding that the person who is going will come back, so that the anxiety is slowly and steadily goes off. But as I said, that it, in few cases, it may happen that the child suffers from anxiety even beyond 2 years. In fact, this may be carried on till adulthood. So separation anxiety is common, but separation anxiety disorder is not, and that is what needs to be taken care of. In fact, as I said, that children and adult both can suffer from separation anxiety disorder, but the reasons of both of these having disorder is different. A child may suffer from separation anxiety disorder because he feels that the parent or the caregiver is going away, and an adult may feel the separation anxiety disorder when he feels that his loved one or his partner is going away, right? So there is a difference between both these anxiety disorders, but yes, both can suffer from separation anxiety disorder. So moving forward, what are the major causes of these, separation anxiety disorder? Major causes for a child having separation anxiety disorder can be related to somebody's death in the family, or probably the separation of parents, because of divorce or mutual conflicts, or probably the parental absence can be one of the major reasons. In fact, the geographical movement and relocation also results in separation anxiety. Change in schools or anxiety diagnosis in a parent can also affect the child, and parental alcoholism or drug abuse can result in this disorder, and foster care or adoption can also cause anxiety disorder, separation anxiety disorder in a child. But when you talk about adults, the causes of separation anxiety disorder in adults are different than what is there in a child. For example, the adults may be having this disorder because of loss of loved one. There may be few life changes, and a strict parenting upbringing or diagnosis of an anxiety disorder as a child which has not been addressed, and other anxiety or mental health disorders as an adult which has not been addressed till date and results in separation anxiety. The surprising thing is that the causes of having this anxiety is different in a child and in an adult, but you will be surprised to know that the symptoms are almost the same except few changes. The symptoms of this anxiety disorder in a child and adult are same. Few of the symptoms are like they have got a fear that something bad may happen to a family member, or it may happen that you may lose any family member, and this is a fear which always keeps on going in their head. So fear of being getting lost, or it may happen that following caregiver around the house, the person just keeps on going around and behind the caregiver or the parent, or they have the fear of being left alone. So this is common in adult and a child. But as far as child is concerned, something like a child may also, if he's suffering from a severe disorder, the child may happen that they wet their beds, or probably they may get nightmares. And in contrast, the adults may have panic attacks and may lead to social withdrawal symptoms and difficulty in concentrating. Once we understand what can cause separation anxiety disorder and what are the symptoms, we definitely need to take care of it, and there are few techniques in which we can manage. To begin with, in a child, it happens that if you are a working mother, you have to go to office and you have to leave the child behind, and a lot of times, because you have been with the child say 1 year, 2 years, the child is used to of you being at home and clinging to you. So in this case, you just cannot separate yourself at one go from the child, because the child may not be able to bear it at once. So you have to start the habit of staying away from child, for to begin with 1 hour, 2 hour, 3 hour, right? So that the child starts developing the habit that you are not around, right? And the child is saved with the caregiver. Also, once you start going out, you always need to communicate this to the child that you are going away and you will be back. And once you are back, you need to talk or spend some alone time with the child, knowing what happened. Maybe the child is not able to talk, but you can always have alone time, so that you and child can share the bond, which has been missing during the day when you were away. And as far as taking care of adults who suffer from separation anxiety disorder is concerned, we can always go for cognitive behavioral therapy, in which we tend to share the emotions. We try to tide, the patient, and take care of this anxiety. Apart from cognitive behavioral therapy, which is also known as CBT, we can also go ahead with dialectical, therapy, the type of therapy that helps you deal with difficult emotions. You can also go for family therapy and group therapy. So these are few therapy which deals with handling the emotions and taking care of your emotions, by talking it out, venting it out. So if it's a mild case, the CBT and dialectical therapy and group therapy and family therapy may help. But if the case is a little severe, so obviously the medical treatment is something, or medication is something which is always advised. So having understood that separation anxiety is normal, but the disorder is not, we can always go ahead and take steps to work on it. As always, I whatever I say, that to treat an ailment, first of all we need to understand and accept that there is an ailment. And once we have the acceptance, only then we can go ahead and treat it. So this is something, separation anxiety, as I said, majorly is found in child, right, or children around 2 year and beyond. So if we see some of these symptoms in a child, we really need to look for some solutions, so that the solution is found well in time, and this type of disorder can always be avoided. Because if it is not taken care in childhood, this will creep into the adulthood and may literally spoil relations and mental and physical well-being of an individual. So thank you so much for watching. God bless.